One of the things that I like doing, obviously, as you all know from if you've been with us for a while or not, is obviously integrating science into the practices that we have. And for some people, it's important. For others, it's not. For some people, it adds an element of groundedness in the practice, which can help. For other people, it gives them a greater reason to actually do the practice, or that if they know that something, let's say medical is going on, or therapeutically physiological is going on, then they might actually do it more than saying, have a seat, take a breath. It'll relax you. When you actually, when you understand some of the mechanisms that are occurring, that maybe you're actually more likely to do it, or more likely to believe in the power of the practice. And so, what a lot of people don't recognize, for instance, is how powerful breathing can be from a therapeutic perspective. And many people I ask, for instance, have you ever had a thought that increases your heart rate? Or have you ever seen an image that increases your heart rate, right? Or a movie. You're going to a movie and it's a drama or a thriller or something like that. The images that you are going to see are going to, you're going to notice your heart rate increases, right? And most people notice, for instance, butterflies in their stomach. Maybe they're anxious to see someone, or they're anxious to give a talk, or they're anxious about going to the doctor or something like that. And so you notice that, I really don't want to go to this doctor's appointment, and you feel those little butterflies in the stomach. And so a lot of us kind of think of it that one unidirectional, in that, thoughts and emotions and images cause stress. If it's one way, if you have a thought that can increase heart rate, then you can actually have a thought that can decrease heart rate. It's not only one directional. It's bi-directional, right? You can have a thought that increases your heart rate, and then you can have a thought that decreases your heart rate. You can have a thought that increases you can have a thought that increases your stress, and then you can have a thought that decreases your stress. And most of the time, we sort of ruminate on all the thoughts that increase our stress and don't really pay attention to the thoughts that decrease our stress. And so for this practice, essentially what we're saying is we need to, increase those thoughts that, let's say, decrease our stress, increase our relaxation, et cetera, et cetera. And the same is true for the breath, right? The same is true for the breath. You have had events in your life that have changed how you breathe, right? That, let's say you get scared. What do? You take a little, you take a breath in, and then you hold your breath, right? And so emotions, thoughts, you can have a thought, and then all of a sudden you notice that you're breathing more rapid and shallow. And so we see it as very unidirectional as well. But what we're trying to drive home in this practice is essentially that if we can have emotions and thoughts that change our breathing, then what we've discovered is that we can actually use breathing to change our emotions and thoughts. Okay, and that's the power of the breath. That's the power of the breath, the power of the therapeutic benefit of the breath. Okay, and many of us don't recognize it, but we're already doing it in day-to-day life. We take deep sighs. Let's say we have a report or something that's due soon. When we finish it, or whatever it might be. But we use these things, right? I'm sure you've taken many deep breaths today. And what you're doing is you're rebalancing your nervous system when you do that. Right. And so now what we're just saying is, your body is doing this naturally. Why don't we bring some conscious conscious activity to it, such that if you do feel stressed, anxious, panicky, et cetera, that you can actually modulate that with your breath, right? You can actually modulate that with your breath. And so we were going through to normal levels. This actually decreased the emotion of anxiety. That's pretty neat, right? That's pretty neat. The other thing is that when we start really kind of focusing on the breath is, remember what I said before, right? As we're breathing, if we hyperventilate, we're blowing away carbon dioxide. So we're creating less of a concentration of carbon dioxide in our tissues. So how likely is it that if we want to deposit oxygen in those tissues, that oxygen transfer is going to occur better when we have low carbon dioxide levels? It's not. So in essence, by hyperventilating, we're getting rid of carbon dioxide. And now, relatively speaking, right, we still need to survive. So it's not like our tissue's damaged, but relatively speaking, there's a less of a concentration of oxygen that is actually being able to be deposited into the tissues, because our concentration of carbon dioxide in the body as a whole has actually lessened. Okay. So that's why some people, for instance, when we start doing breathing exercises and we slow down the breath and we take deeper breaths, that you are actually slightly elevating your carbon dioxide levels in your body, which for every breath then that you take in and bring in the oxygen, your body is actually able to distribute that oxygen better to the tissues it needs to, because you've actually helped that transfer from increasing the carbon dioxide levels in the body. So now your tissues might actually feel as if they've come alive. Whoa, didn't realize that could happen. Tissues, it feels like there's a tingling, but not like a nerve damage tingling, right? Like a diabetes neuropathy tingling, like an aliveness. Right? We can kind of tell the difference. Oh, this is it's like I just hit my funny bone, my ulnar nerve, right? No, that doesn't feel, that's not very alive, right? But when you feel that tingling, that like your body is vibrating, right? It's resonating. You're like, whoa. And it's almost as if you can feel the gas exchange that's occurring and the oxygen being deposited at your tissues. Okay. The effect of a single or few deep breaths or sighs to induce calm is postulated to be due to the acute lowering of carbon dioxide. However, tissue carbon dioxide, unlike blood, are largely stable at short timescales, such as 1 or 2 breaths. So experimental evidence for an acute effect via this mechanism at shorter timescales is required. So we're looking longer timescales here, right? But still, that's what the purpose of a sustained breathing practice is. A sustained breathing practice is. Okay. Those are the 6 mechanisms. We've talked about every one of them. I think they're really cool. The last one, of course, we took a little bit longer because it's blood gases, but you are affecting, when you change your blood carbon dioxide levels, you can ameliorate symptoms of anxiety that typically when we are panicky or anxious, we're in a state of hyperventilation to some degree. And every time we do that, we blow off carbon dioxide. And so if we alter that mechanic, we can actually really improve or ameliorate the symptoms of anxiety. So some people, depending on most people, for instance, if they breathe rapidly, or if they change their breath in any way, you can feel the sensation of lightheadedness. Mostly it happens if you hold your breath for a long period of time, you can get it. You can also get it have hyperventilating. People who hyperventilate can. So there's many reasons that dizziness occurs. Anytime that you feel dizzy, irregardless of what is causing it, you really want to just lie down, because your body is trying to adjust to whatever is happening. When you're stressed, your heart pumps fast, and your blood vessels squeeze down. So your heart rate goes up and your blood pressure goes up. Okay. If you're really stressed, let's say, and your heart is beating, and then maybe you do like a practice where you relax a little bit, but your heart is still beating quickly, and there can be so many different mechanisms to feeling dizzy. A lot of times, just the stress itself can cause it. It's called a vagal response, where I don't know if you've ever just, this happens to people like who are sensitive to needles or blood. They see blood and they just pass out. It's like they can't handle it. That's what's called a vagal response. That's actually too much vagus activation. So there's such a big stress that comes in that the vagus nerve just sort of collapses, in essence. And you are not able to maintain blood going to your head. And you get dilation of your arteries and veins and things like that, and then you collapse. So there was so much going on that I would say do the practice when you're not stressed and see if the same thing happens. Regardless of, let's say it does happen, then you are changing the acid base. You're actually changing the chemistry in your body, and some people are very sensitive to that. And so if you do it, like let's say let's say you're breathing at 20 breaths a minute, and then all of a sudden you start doing a breathing practice and you go down to 3, that might be too much of a shift for your body. And so in that big change, then your body might react and say, "What are you doing? Stop." In essence, dizziness and passing out is kind of a neat thing, because it's like, hey, whatever you're doing, stop. Okay, so let's find a comfortable posture. A posture that you feel relaxed yet alert. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze. And taking 2 or 3 deep breaths. And just allowing yourself to be here now as best you can. And to bring your attention to your anchor. that place that you can direct your attention to that feels safer. That as your mind wanders and gets pulled off to any one of the activities of the mind, such as thoughts, emotions, or sensations, you simply come back to your anchor. And now, if you can, directing your attention to your breath. If you notice in your body where you notice the sensation of the breath the most, and notice it as a sensation. It might be on your upper lip as the air flows. It might be the expansion and contraction of your chest or belly. It might be the sensation of your whole body breathing. And with this practice, knowing that with every breath, you are directly regulating your physiology. And taking 2 or 3 deep breaths, and noticing that as you breathe, there's direct and indirect neuronal connections into your brain. And noticing how that makes you feel. Simply bringing your awareness to that anatomical and physiological connection. And taking another 2 or 3 deep breaths and feeling the pulsatile nature of the breath through your nose and on your olfactory bulb. That the breath goes up into the middle of your head and actually pulsates the neurons that are directly connected to your brain. And taking another 2 or 3 deep breaths and knowing that you're actively activating your vagus nerve. That we don't need an external vagal nerve stimulator. That we're simply doing it with our breath. And again, taking 2 or 3 deep breaths and knowing that we're altering our oxygen and carbon dioxide concentrations in our blood. That as we breathe rapid and shallow, we get rid of carbon dioxide. And as we breathe deep and slow, there's a relative increase in carbon dioxide in our blood. And as we breathe, taking 2 or 3 deep breaths, we're activating our chest, our rib cage, our diaphragm. Our organs, our liver is being pushed down when we breathe in. And that has a direct effect on our brain as well. Noticing how we feel. Is there any mechanism that you feel more connected to? Or do you feel connected to a few of them or all of them? Or do you simply feel connected to the breath? Whichever one it is for you, simply maintaining that practice. Breathing in and out, in and out. Knowing that with each in-breath and out-breath, you're directly affecting your brain in all the areas of emotions and cognition. Helping to feel more relaxed, at ease, and at peace. Just noticing where you are now, coming back to the breath if your mind has wandered. And noticing how many breaths you need, a minute. Has your body felt more relaxed? And now, taking 2 or 3 deep breaths, noticing how you feel, both body, mind, and spirit. That with each breath, you actually sent little signals to your brain. And opening your eyes if your eyes were closed. Reorienting yourself to your room. Stretching if you feel like you need to stretch. And just taking a moment to reflect on your practice.